Good day. This is Rizwan Butcher, Chief Innovation Officer at INNONATION. And today we have with us Dr. Shafeeq Haider, who is Director of Life Sciences at Zauq Health. He's a man who is revolutionizing healthcare, transforming it, has a dream of making change happen in Pakistan, especially with focus on patient safety. So today we'll talk with him on how we can actually, because patient safety is going to be a super challenge. It was in Pakistan, but after the current pandemic, it is going to be super huge. Going to hospital can actually be, I mean, if you do not need essentially to be there, you must at least avoid it. But if you are there, the patient themselves and the care provider, caregiver, assistants, how they can have an impact on patient safety. And most important thing that we will talk today is why and how you should not be a patient in the first place. So, Dr. Shafeeq, what is your opinion and how you suggest that we should not be a tentative, a possible patient ever? How to have that preventive lifestyle?
Thank you for having me, Rizwan. That's a good question, and they're very relevant with our, current context of Pakistani society. Our society is very different, as compared to other Western societies, and we are closely intermingled nation. Uh, and this has its own positive and negative aspects. I don't need to ponder on, shed light on the positive aspects. Of course, there are, but currently, I'll focus on the negative side. Our society, they intermingle with each other. There's highly religious society, which is a very good thing, but we are highly ritualistic. So, number one, the society should abstain from big show-off gatherings like marriage ceremonies and dancing, and I mean, these ceremonies you should contain it for the time being, okay, till the time the vaccine comes, and you can do it at no cost. In fact, it will save you cost. The second thing is the religious ceremonies. Yes, of course, you carry on with your religious ceremonies and with your beliefs, whatever those are, but inside your house. Outside, if you go to your worship places, I mean, you will harm your own brothers and sisters, and of course, harm yourself. The disease will spread. And similarly, if you go unnecessary to hospitals, I mean, I don't want to say it, but frankly speaking, the hospitals, they are just like bioreactors. I mean, you are going there without any protective measure. You should not go. Unnecessarily, you should not go. Okay. And furthermore, all your elective surgeries, all the procedures or the surgeries which you can postpone, please postpone those. Okay. Um, and follow the social distancing norms. All over the world, we are doing it. And the most important thing is, for a common man, you should wear at least a two-ply mask. This is there's a two-ply mask, there's a three-ply mask. You see, three-ply mask, and then there's a surgical mask. I'm talking about the common community face mask. At least you should wear that. Okay. We are not asking you to wear N95 or the other exotic mask, but at least you should wear two or three ply normal community mask all the time. And I hope, inshallah, in the next few months, this situation will come under control, and we'll go to our restaurants, we'll go to our mosques, our imam bargas, our all other worship places, our entertainment places, our cinemas, our schools, our universities, our offices. Inshallah, we'll go there soon. But this is not the right time. And I think there is a realization in certain segment of society, but unfortunately, some people don't realize. Another thing which I observe, and for which I'm very surprised, there's a big rural and urban divide. In the cities, people are at least discussing, they're aware of that there is something, a flu-like disease, it's coming. But in rural areas, I was quite surprised. I mean, people are not aware of the gravity of situation. I mean, still all the chopals are there, all the everything melas are there, everything is there. Few times it comes on the media. Most of the time, nobody reports it. So we should send the message in the local language like Saraiki, Punjabi, Pashto. I mean, I met many people in different areas and not in the cities, outside the cities in Pakistan. And the common man in the villages, they don't understand. So I think there's a big need, an urgent need to send them message in their own native language about this disease. Okay. So the bad thing is Ebola is coming. It is pre-COVID stage. No, it has not come. It is coming. It will come. It will strike us. And we don't know for how long the war will go on. But the good thing is that we can fight it. This is the good news. We can fight it through prevention and by avoiding the triggers. And there are a few other things like we need to sleep early, because if you sleep at 10 o'clock, I mean, the growth hormones, and other protective hormones they develop in the body. These may give you protective or better immunity. Similarly, eat healthy diet. Uh, and there are many, I mean, Pakistan is rich in fruits. Take fruits, lot of fruits, and come closer to nature. These are cheap. I mean, these are not expensive treatments. Allah Ta'ala has provided us with all of these things. These are all not cheap. These are cheap. These are freely available. So I hope, inshallah, we will control it after some time.
Okay. So another thing that I wanted to ponder upon was WHO released its statistics that 4 in 10 people are harmed while they go get care. It was related to patient safety, and every minute 5 people die due to unsafe care. It's going to be mind-boggling and an exponential change in this statistic after this pandemic. So all of us should have a preventive approach, should boost our immunity, should rest well, should sleep at time, go back to the nature, and go to your own personal pharmacy. That is your body.
Exactly.
Find it, nurture it, just grow it with natural fruits. So another one thing is that then there is government who can enforce lockdowns and control things, and then there is community. So how do you think of where does community plays its part, and government can enforce things? And there are certain things which we cannot control, but then have in a very effective preventive protocol in place.
Well, government is doing its part. They are trying to do, but the issue is their decisions are mostly populistic. By populistic, I mean those are based on political priorities. While we are healthcare workers, we are professionals, and our point of view is slightly different. But they are trying. We know government is trying, but they have their own constraints. We understand that very well. I think the community should come forward, and community should help themselves, and community should help the government as well. How? Well, um, if you have mosque in your area, your community should talk to the ulma. Let them have their partners, because ulma, they have a strong influence on their society. They are very well respected, and they should be engaged. You see, they should spread this message of social distancing after azan. You see, so these ulmas could in fact act as a warrior along with healthcare workers. We can develop a ulma public partnership program. It's a noble program, and through the members, through the mosque, they could spread this message of social distancing. You see, there are several ahadith, there are several ayat related with disease, related with these epidemics, pandemics, and our prophet has already given many advices. So the ulma can propagate those advices. So they could play a very pivotal role, and I think we have deep respect for them. And yes, and some of them, they are playing the role, and mashallah, and they are doing, and the people are listening to them. So the community, and they belong to community. Similarly, there are in every community, there are town halls, there are community centers, and those of course needs to be closed till the situation settle down, or even if they need to be opened, it should be opened in a very cautious way. I mean, people should have a 6 feet distance, and they all have, most of them have already received the standard operating procedures from the government of Pakistan, and I think the community should help government of Pakistan to implement those social distancing rules.
So before we close this session, one last question was that we have an affordability issue in Pakistan.
Yeah.
What are the most cost-effective, doesn't cost much, immunity boosters, disinfectants, how you can have personal hygiene? I mean, it doesn't take a lot of money, and it are very technically difficult to do. Things that you can do from your kitchen, things that you have in your laundry, things that you have in your home most of the time, so you can just buy them very easily.
Yes, you see, the bad thing is the virus is there. We are fighting. The good thing is that fight is not very difficult, and in fact, it's not very costly. I mean, as you said, I mean, there are a lot of things which are, which you can find around yourself. I mean, these things are found in kitchen and in bazaars everywhere, and these are very very cheap. For example, nobody has stopped you from sleeping early. You can sleep early. Your immunity will I will not say boost, but it will improve. Similarly, take the fruits whatever available in the market. You see, the oranges, bananas, and whatever available in that weather, take it. You see, these fruits are full of vitamins and other minerals, and these are immunity boosters. I don't want to say any particular fruit, but you can take all the fruits. And Pakistan is rich in fruits. Uh, Similarly, regarding the disinfectants and sanitizers, yes, you have to be very careful in that, because a lot of doctors and healthcare workers have been infected because of the false sense of security. The sanitizer should have at least 80% ethanol. I repeat, 80% ethanol, or otherwise they should have ammonium oxide, or ammonium molecule. But ethanol is the gold standard. Ethanol 80%. They should check. Or similarly, they should also check the credentials of the sanitizer and disinfectants. Are they approved by FDA or CDC or DRAP? You see, or is it from a established source? Or you go in the market, you will find a lot of vanilla sanitizers. I mean, you can even just see the finishing. You could even you just see the bottle, and you know that this is fake or spurious. So and the other thing is, in houses we all have soaps, we all have detergents. I mean, you just wash the laundry and wash all the plates or kitchen items with the soap, and wash every day with soap. Soap kills the virus. So the good thing is that most of the real arms, they're very cheap. PPEs are cheap. It's not expensive. Soap is cheap. Sanitizer is still very cheap. Sleep is, I think, it's free so far. Uh, so Allah is blessed. Let's fight this war.
So my next question, and that would be the last question actually, and which a lot of common people ask me. If soap can kill this virus, I mean, why can't we make medicines? Why it's so difficult to make its medicines?
Well, I want to give a Nobel Prize to the community person. Well, well, He's right, but you see, soap you use outside the body. The drug you use is inside the body. You see, the virus goes inside the body through your nose and through the mouth. See, then it goes inside, it stays some time there, and then it goes down to the throat, and it then goes down to the lungs, and then it also travel to brain and to lungs and to kidneys. Obviously, but I can't clean my lung by opening my chest and clean it by soap, or I can't ingest soap through my throat. So these throats and all these disinfectants and hygiene products, these are used outside the body. Virus is inside the body. This is the only thing. But that's a good question. I enjoy
So,
it.
so let's call it a day on this note, and just busting this myth. And we look forward to next session, and we'll focus that as a myth busting session. Thank you for your time.
Thank you. Thank you very much.